Today we are going to look at a very important topic that has to do with substance abuse and its health effects. Substance abuse and its health effects. And this is a 1 hour program. So just with time not in our favor, we'll go directly into our first segment. This program is brought to you by Progressive Health Initiative of Liberia, a local health NGO that is into community health promotions and other activities in keeping our environment safe. So at the first segment of our topic in today's presentation, we'll look at the definition. What is substance abuse? When we talk about substance abuse, what we mean? What are common substance abuse in our community? So for us to go deeper a little bit, what are the specific substances that are most commonly abused in community like ours, like where we live? So for answering this question, we say in community across Liberia and where we find ourselves currently in Maryland County specifically, the most commonly abused substances are numerous, some of which are alcohol, which is very widespread. We have marijuana, which many young people feel is harmless, but it is not. We have Kush, a highly dangerous synthetic drug that has destroyed thousands of young lives across West Africa. And then prescription pills, especially pain relievers and sedatives, and increasingly hard drugs like cocaine and heroin in urban areas. So these are just few lists of commonly abused substances in our environment. So now, as you have listened to us, you may have heard these names before. You may even know someone who uses them. The important thing is, what do these substances actually do to human body? That is what we want to unpack today. Those substances we just named, what it do to human body. Maybe you have seen somebody before who have been abused by these particular substances we have named. So why do people start using substance in their body, taking them into their body? Why you think people can do that? We'll also look at that. So we have come to break some barriers, to explain some practical things that we need to do, we need to know, and saving ourselves from this abuse of substance. So once we ask why you think people start using substance abuse, and this is a substances in their body rather. This is a very nice question. You see, people begin using substances for many reasons. People have so many reasons for using substances. Some of the reasons could be peer pressure. Peer pressure is the major factor, is one of the major factors you see people using substances, because especially among young people who want to belong, you will see them using substances. Some people use substances for stress and hopelessness. We have stress, we have trauma and pain. People use substances to escape difficult emotions or situations. Some of them, when they are faced with situations, they say, no, I give up already, so it will be better I use it. Some use substances because of poverty and hopelessness. They don't have hope in their future. When people feel they have no future, some people feel that I'm just living recklessly.
Yeah, everything is over.
Oh, thank you. Everything is over. So what I will do, let me just satisfy myself by taking in any other thing to my body. They turn to substance for addiction, begins through legitimate medical use of prescription drugs. Because sometimes if you go to a drugstore or something like that, you want to get a trauma dose or something, maybe they tell you they prescribe this drug to you.
Want what?
But if you get to your destination and you overdose yourself.
I wonder.
Yeah.
I see somebody who they told him taking one, but he said it being too intensive, so he make it too.
Okay, so I think we discussed it before when you self-medication. So he took two because of the pain was too much. So is it not always a matter of bad characters? Because other people feel when you take in substances into your body, sometimes some people feel it is a bad character. But we are going to make clarity on that tonight. it cannot start very, you see, the aspect of taking substance, some people taking substance and later on they get somehow confused. So it can start ignorantly. It can sometimes start innocently. People can be very innocent and then they sometimes take it to be something good.
Because at first,
And they begin. So precisely we want to talk about addiction. Addiction is a disease. It is not a bad character. It is a disease, and this disease, it is not a moral failure. It's not a moral failure. We must stop stigmatizing people who struggle with it and instead offer them understanding, support, and pathway to recovery. Because some of them are even planning to do what they are doing. Like what we talk about peer pressure. Friends encourage them and they're trying to imitate. So that will take us to the second segment of our presentation that has to do with health effects of substance abuse. What are the health effects? On this segment, we will look at physical health effects. What are physical health effects of substance abuse? So now this is the heart of our today's discussion, the physical aspect. So the heart of it, what does substance abuse do to the human body? That's what we want to understand tonight. So the physical health effects are devastating and in many cases permanent. Let's break it down. Let's break it down to body system so our listener can really understand. So breaking it down to the body system, we will start with the brain. It's one of the physical effects. The brain is the first major victim of any substance abuse or substance you take into your body. Most drugs hijack the brain. The brain has certain part we call the reward system. The reward system, when the substance hijack it, flow with chemicals that produce pleasure. It is a normal phenomenon within the brain. But once it has been hijacked by this substance over time, the brain stops producing these chemicals naturally and becomes completely dormant. On the drugs now. So once the brain stops producing what it used to produce normally, the brain depend and rely on the drugs or the substance you're taking now to work. So it becomes an effect very paramount to the brain. So let's look at over time, the brain stops producing this chemical naturally and it becomes completely dependent on the drugs you're taking. And this can lead to memory loss. Sometimes you lost your memory. Poor decision making.
Because I hear people say, when I take this thing, it make me to think. So that means whenever he take that thing, don't expect him to think.
Okay. And that memory loss we're discussing now. Like what you say, memory loss. Then poor decision making. It also comes in. And inability to feel happiness. Yes, without the substance, without this particular substance, you don't feel fun. There is no appetite for good feeling anymore unless you get there. So the heart suffer greatly from substance abuse, cocaine, and we have certain one we call the methamphetamines. The methamphetamines and the cocaines. If the both of them when they go together, they bring what we call irregular heartbeats. When you close to this, after the brain, the next thing that affects is the heart. And looking at cocaine, it brings heart attack and even sudden death. It brings sudden death. Alcohol causes high blood pressure and heart disease. That's why it does. And what happened? Intravenous just use. Intravenous just use. The intravenous means some people say if I put it in my nose, it won't take effect as soon as possible. So they look for syringes and inject it directly into their vein. They say they want for it to stimulate faster. And this is one of the dangerous way of doing it, because anything that goes straight in the vein, it goes directly to the blood and run in the brain and other part of your body.
So it makes them to be
So the intravenous just news can cause infections of the heart lining. The heart lining, the capillaries, we have the veins, we have the various vessels that blood deoxygenated blood, oxygenated blood, all these things, they are not to par together. Okay. But you go and put just directly into your vein. What you do to yourself?
You are actually destroying.
You're destroying the heart. Yeah. So this is another aspect that affect the heart. Then let's go to the liver. What substance abuse or substances does to the liver when they are taken massively? The liver take a brutal hit from alcohol. Alcohol-related liver disease include fatty liver, hepatitis, and cirrhosis. And this is one of the leading causes of death among heavy drunkards.
Yeah.
Yes.
You will always hear people say, the person no more, person is person later.
Yeah.
And so sometimes things can really be like a person.
Yeah. It can really be person, yeah.
It can be, yeah, like the,
I think you just heard about sudden death.
Yeah, sudden death.
You will just when the immune system is compromised, when your heart is damaged from the high intake of substances that are not helpful to your body, it causes you sudden death. Yeah. Some of those deaths that happen around here, they are not poison, or they are not, they can say,
maybe someone is responsible.
Yeah, we can say that country sound, or yeah. Sometimes it is not that. The way we think can be different. Sometimes it is based on the type of things you put into your body. So the liver supply, it can keep up with what? Breaking down of toxic liver and other alcohols. So if the liver is getting certain toxic agent that it is not even supposed to get, and the power of the liver cannot even reduce it, what happens is that you putting, heavy load on a little child here, and you expecting them to throw it from here like Plebo or Barrican. They will give up, they will collapse on the road. This is what happened to the liver when the toxicity is too many, on the liver. So let's move to the lungs. It also affects the lungs. The lungs are severely damaged by smoking substances. It can damage the lungs. Whether marijuana, tobacco, or crackers, cookies, what happens? It damages it. And this can lead to chronic bronchitis. The bronchitis is a disease. The bronchia is a tube that takes air directly to the lungs. So when it is affected, that is the name of that sickness, the bronchitis. It brings you what we call lungs cancer. It will give you lungs cancer also. So smoking is not something to overlook. It also bring in what we call respiratory failure. And then you see some people just, they face problem with even breathing. It becomes very difficult for them. And if you sit sad, then you see them, they breathe. The normal way of breathing, you will notice that it overseas. You should know that something is wrong somewhere. Then let's look at, due to time, we are just moving faster. Let's look at the immune system. High intake of substances also affect the immune system. It weakens significantly with substance abuse, making the body vulnerable to infection. The immune system, it's a defense system in our body. And if I'm not mistaken, there are 5 inroads. So those 5 defense systems, when they are broken down, when they are compromised, what happens? Your body is vulnerable to any infection. So just users who share needles are at extremely high risk of HIV and AIDS and hepatitis B and C. Yeah, hepatitis B and C, needles and other things. Yeah, they can get it anytime. So these are serious life-threatening conditions that the physical aspect of substance abuse can lead to all these things. And when we look around our community, we can see the sound. We can see it in our environment. People who look much older than they are. People who are sick all the time. Someone is like 25 years, but their appearance, when you see them, they look like someone who is 40 years.
Yeah, because the drugs really give them different colors.
Thank you.
Give them different appearance.
Thank you.
Their voices. I will cough throughout the
entire. Okay.
And if you see them trying to talk, the voice will always come from in.
Oh, you actually understand what we are discussing.
Because
And the body will depreciate
yeah.
from within. It will get out, and physically people will know that you are depreciating in both complexions, appearance, and everything.
And they also part of it that they will feel like, because whenever they find themselves in that condition, they'll say, but then I think since you leaving this far,
Yeah.
just continue.
Let's continue. Okay. So you will notice that substance abuse, it ages the body rapidly.
Yeah.
It makes you older than your actual age.
Of course.
That's why it does. You will see a 25-year-old chronic drug user can have the body of a 50-year-old man or 50-year-old woman.
Yeah. Right here.
So the deterioration is visible and it is all heartbreaking, and we can see it in our environment on a daily basis. So let's look at the mental health effect of it. We just there with the physical part. So for the mental health effect, we want to know how does substance abuse affect the mind. And we'll look at all these things because it affects the mind a lot as well. So this is equally serious. Let's discuss it. It is equally serious. Substance abuse is deeply connected to mental health disorder. There are a lot of disorders when it comes to mental health. So the first one, many people use drugs to cope with conditions like depression, anxiety, and what? Trauma, which is not the appropriate ways or recommended approach to do it.
Somebody is feeling trauma and they take additional trauma.
Yeah, for you already traumatized. Then you take your trauma to yeah, so it is not advisable. And it just make this condition far worse over time.
Yeah, because at least you should have time to think properly of how to handle it.
Thank you.
You use drugs and then you just lay aside and the drugs control you.
Yeah. And the substance abuse can trigger psychosis. Psychosis is a state where a person loses touch with reality. You lost the touch of reality. You lost hearing of voices normally. What happened next? It causes, or you even see things that are not there. So some of them can say, I was walking and then I saw something appear like a hole.
Yeah.
And
you
will see something that is not in existence.
Yeah.
That what sometimes what happens, that what we call psychosis is a condition that comes the way of any drug user when you are chronic within it. Sometimes you will see some people, they will be walking when they are intoxicated already. They will be behaving like they are jumping over holes. Nothing is there, but they are just imagining that something is there. That's psychosis. It's very bad for us. It is bad. And you will hear some people, you will hear voices, but those voices are not actual voices from people's mouth, but you're just hearing them. So what happened? This is very common with kush. Yeah, kush is very dangerous, like what you were saying. So like to jump over holes that is not in reality, all these things is very common with kush. So it causes severe depression and suicidal talk. So when you are involved with this, now the next thing that comes to mind, sometimes you feel of committing suicide. Yeah, that how you will be feeling. It destroys the concentration. It destroys your concentration. It destroys your memory and the ability to learn.
So if there's somebody trying to comfort you, motivate you, or trying to tell you anything, all that comes to your mind is, when you feel talking, let it go
in wasting your time. Yeah. So this is why substance abuse is so devastating when it affects young students. Like when you go into school, because it will affect your memory.
And it kills dreams. It kills a lot of dreams.
It kills millions of dreams. Yeah. It kills it. Yeah. So substance abuse and mental illness often go hand in hands. The both of them. Substance abuse and mental illness. The two of them, they are best of friends. They can't do away with each other. So the doctors in our rural hospital and health center, they call this dual diagnosis. That the name they have for them. Mental illness and substance abuse, they call it dual diagnosis, because treating one without the other, it can't work. You cannot treat mental illness without treating substance abuse, because if you try, it will not work. So both need to be addressed together for recovery to be possible. So two of them, they are brothers, and you need to tackle them together. So let's look at the social and family health effect. It also affects family and it affects the individual socially. So beyond the individual now who is involved with this, what do you think it can do to the family? That's what we want to discuss. Even though I'm Isaac Blair, I'm the one who taking in my sustenance, but it has an effect on my family. Yeah. So you getting it right? So the rapid effects are innumerous. They are many. Family breaks apart. It can break family apart. It distinguishes people a lot. It set boundaries when it comes to the family level. Children are neglected and abused. Breadwinners for family lost their jobs for substance abuse. Domestic violence increases dramatically when alcohol or drugs are involved. It increases. What happened? Children who grow up in homes with substance abuse parents are far more likely to develop substance abuse problems themselves. Like your dad is
taking it
every day. Why do you think he will tell you?
Even before you even become, you have to try it one day.
One day, yeah. He will even send you to to guess, yeah.
My mom already do the thing, so at least I'm gonna find out.
And what happened in a community? Community will lose their most productive members.
Yeah.
The people who supposed to make impact in a community, they are considered messed up already. The cost emotionally, socially, and economically is what? It's shocking. It's shocking economically when those who supposed to make impact in society are addicted to drugs and substance abuse. It is emotionally affecting our society. It is economically affecting our society. It is also socially affecting our society.
Yeah.
So this is something that is shocking, meaning it is in large quantity.
Yeah, because you see a lot of young people, who should be controlled by parents now want to control their parents.
Okay.
Because
because of this.
And when the child sort of behave that way, you can control your child. So in terms of decision making, say your father knows to say your child is the one
controlling you. Yeah. You want to.
So
you don't control your child. Your child control you. Then here you want control us. Yeah. So let's go to the segment 3 of this presentation where we want to look at who is at risk.
Okay.
Someone must be at risk.
Of course.
So we want to talk about who is most vulnerable. Is it just young people or does substance abuse affect everyone? We want to look at that. So in looking at this, we'll say substance abuse does not discriminate. When we're discussing about substance abuse, it does not discriminate. It affects the young people. It affects the old people. It affects the rich people. It affects the poor people. It affects men. It affects women. But in general, certain groups are at higher risk because there is percentage to everything.
Of course.
So it affects almost everyone. But certain group of people, they are at a higher risk. And our people, they are the young people between 15 years to 35 years. They are very much at risk because they are in their growing stage. They are in their growing stage. They are quick to be moved. They want to make it in life.
Very quick.
Very quick. So they are they are very vulnerable. Yeah, their brains are still developing and they are more susceptible. Okay. Meaning they are more likely to addiction. Yeah, the young people. We as young people, we thank you. On a daily basis, they bring the different thing to do. So people who have experienced trauma, abuse, loss, conflict are at higher risk as well. Those who live in poverty, they are also at high risk. Unemployment. People who are unemployed, high level of unemployment. People with family history of addiction. And those with untreated mental health conditions, they are also at risk. If I have a mental health condition that is not treated for a very long time, anytime my head can pop. Like what we usually say, the man head pop. Yeah, new moon. Okay, yeah. Thank you. So once the new moon is there, I will jump that, go do what I'm supposed to do. So what about our young people specifically? What warning sign should parents watch for? Warning sign. You think is there any warning sign that the parent should watch for?
There are a lot of warning signs.
Okay.
And here is the thing, because a child who used to listen to the parent, the moment he start to follow friends and then he start to take drugs, he see himself superior.
Okay.
That one.
Okay.
When the parents are talking to him, everything they say, he sees it to be like someone who just advancing a tree.
Okay.
He doesn't hear anything from that.
Okay.
And he will always want to tell them, like children say, anytime a child says, you born me, you don't born my heart.
Yeah.
Additional habit.
Yeah, sure. Sure.
A child came out and later they had fallen.
Yeah. It never happened.
They gave birth to the child.
And later the conscience came.
So these are the sounds. When you see them try to feel like they feeling big.
Yeah.
They try to demonstrate
pomposity. Feeling pompous over their parents' advice.
Thinking that they are living the life that they are called to live. And feeling that the way they are doing things is the right way to life.
Thank you. There are a lot of warning signs that parents, like what you are saying, you want to control your parents. You want to analyze more than your parents and to make your decision more permanent. What you say should be the final. Okay. So parents and guardians should watch for sudden changes in behavior. Because the contemporary society nowadays is very dangerous, where we need to take care of our children and be very sensitive in observing their behaviors and attitudes. So the changes in behavior is led by something that might have triggered them out. So the first thing a parents or guardians should look at is sudden change in behavior. And then different behavior you see your boy child. And nowadays, not only boys children into substance abuse. So the girls children are also heavily involved. So when you see this behavior, withdrawal from family. When a child or when a man or a woman is involved in the substance abuse, he or she withdraw himself or herself from the family. They will only go with their, we can say, bird with the same feather flies together. Okay.
You know, they always believe that the family are the one against them.
Okay.
So they found people who is for them.
Who allude to their understanding to just do things in common. And another thing we advise parents to look at is dropping performance in school. If your child is in school and this child begin to drop performance rapidly, you should also try to do some investigation on that. Observe it. Yeah, substance abuse contribute to that as well. And new friends, they are secretive about. There are other friends, they don't want for their parents to know them. They're very secretive about those friends. Be careful.
And these are the kind of friends when the parents say, I don't want to see you with a friend. You say,
It becomes like a riot between the child and the parents because of this secretive friend who is leading them to this abuse. And another thing that we want for parents to notice is unexplained money or missing valuables. Items that are missing in a house. Things just begin to get missing. You can't find them. Who is doing this thing? And then whenever it gets missing, maybe your boy child, your girl child gets out and spend more than 2-3 hours. They come to the hall maybe in the night or the next morning. You should also try to observe it. It can sometimes lead to sustained abuse. And we have rare eyes. Even though the eyes has they are natural eyes that are rare, but if this child, you notice them from the day they were born, their eyes is not a rare eyes, but all of a sudden you notice that your boy child eyes just getting rare unconditionally. You should also be careful and do your investigation on that. Then there's a statement here we call slurred speech. Slurred speech are speeches that are not understood. When they making some statement, you can't understand what they are saying. Like they're speaking in tongue. Be when you can't fly toilet or toilet. I do. Okay. So when slurred speeches are coming, Brabi, and then maybe like I met a guy who he was trying to ask me for something. He said, Brabi, can I get some booklet from you? Can I get some Dan Moko? You know, he begin to give all sort of names.
Okay.
I was like confused, but if I talk about Berkeley, I'm discussing $500. I say, wow, you're talking about money. So these are slaughtered species. When they are coming out of the mouth of your children, something suspicious is going on. And then unusual smells. Substance abuse also comes with unusual smells. These are warning sounds that we listen to our parents and our guardians to take notice of them. Unusual smell, loss of appetite. When they are into these things, some of them don't come around food too much like before. They lost appetite.
Because their appetite is already
in a just already, yeah. Yeah. So some of them, their mood is very drastic mood. When you see them, they appear always serious. Once they into it, their facial appearance, morphology, everything changed. They appear serious when they walk inside. You notice that they're moving. Okay, so these are warning signs. These are red flags that should not be all these things that we listed, they are red flags. Don't ignore them. When you see them, check on them. Don't panic with it. As a parent, we advise that when you see them, don't panic. Do not immediately confront in anger. When you see them, don't confront them in anger, because the way you will approach it, that's the way they will someday. Because when you confront them with anger or in anger, as soon as possible, some of them they get out from the home. They go straight to where they want to go. They move, and once they leave you are not going to follow them to where they are going to be living, sleeping, and other things. You will like for them to come back home. It takes 2-3 months.
They come back home and become someone different.
Very different. And you are also they will harm you when they are coming. Because the mind, like what we describe, the mental, health has been affected also. So they are not even looking at you as parent any longer. You are like a prey to them now. Yeah. So they can even harm you. So don't panic with it. Don't confront them with anger. Approach them with love and concern. Have an open, honest conversation with them. Tell them this is not good for you. When this continue, this is where you are leading to. This is how I started my life, and these are things I did for me to reach this far. I mean, with honesty. Trust and other things, engage them, but don't do it with anger. Yes. And then we seek professional early. There are other professionals who are glued with the authority to talk to people like counselor, early intervention, and hope. It can help you for them to be somehow. So let's go to segment 4: prevention, help, and what? Recovery. I think this is one of the areas that is good for us. Prevention strategies. Prevention is always better than cure. We can make that common statement among ourselves. Prevention is better than cure. We should not overlook that statement. That statement is 100% truth. Prevention is better than cure. So what happened? What can individual, family, and community do to prevent substance abuse? There are a lot of things individual can do, family can do, or the community entirely can do to prevent substance abuse. And one of the things I want for us to look at, prevention we're discussing, is start at home, it start in school. So parents must build open, trusting relationship with their children. So young people feel safe to talk about peer pressure. If you can create that environment for you and your child or children to have open conversation, it scare them away. And if peer pressure comes their way, some of them will not, because there is no space for discussion, they will not tell you. And they are going to fall prey to that. And when they fall prey to that, it becomes chaotic. Affected greatly. At times, a small thing will start getting messy from the house, they carry it. Yeah. So school must integrate just education into their curriculum. This is getting serious. School must do that. Let it be integrated into curriculum. Not scare tactics. It should not be integrated to scare students. But why it does? But real honest information about this particular substance abuse, students should be told. Community must provide safe space and productive activities for youth. There should be a forum in communities where people will go sit. If you take in 1 or 2 soft drink bottle, you discuss the effect of substance abuse to community members, to our young people. Sport, outlets, skills training. These are things community members should do. Government agency like Liberia Drugs Enforcement Agency, the LDEA, they also have they must continue public awareness campaign and enforce the just law. In Liberia, in this our country, we have just law. So it's supposed to be enforced by them, and they are glued with this authority. So they have part to play as well. What about people who are already using substance? Is there hope for them? Yes. The answer is yes.
Yeah.
Absolutely. Recovery is possible. They can still recover from it. Every single day, people overcome addiction.
Of course.
Anything you are addicted to, you can overcome them and rebuild their lives. But they need support, not shame. Not because they are into it, then we stigmatize them.
Yeah.
We insult them and we make them shame publicly. No, it is not advisable. We cannot sit here and tell people to do that. It's not advisable. They need professional treatment. Okay. Yes, they need professional treatment. They need counseling. They need medical support, rehabilitation. They need family and community to stand by them, not cast them away. Even if they are harmful, we need not to cast them away. Okay. So where can we get help? That's our next short discussion before I think we open phone line. Where can we get the help? Where can people in Maryland County go for help? Yeah. Yeah. So we want to recommend few places to people in Maryland County. People can reach out to JJ Doxing Hospital. You can reach for substance abuse. You can reach that. They are trained professionals who are at the hospital, at the facility. We talk about counseling. We talk about other, talk to you, position you, give you. Some of them have stories, experience. They will help you. Maryland County Health Team. Go to Maryland County Health Team. The County Health Team is glued with every other health authority here representing the Ministry of Health. You can get to them. It's another place for getting help for this. Partner in Health. This is a health institution, and we know their importance here in Liberia and specifically in Maryland County, where is the hub of their operation. Get to their institution, get to their compound, and seek for help. Progressive Health Initiative of Liberia. Visit our institution. Talk to our volunteers. Call on the radio. When we are having our program like this, call us. We can give you help on this. Awareness can be given. Or speak with any qualified health workers or counselor. Contact the Liberia Drugs Enforcement Agency in Maryland County. The LDA have their office here. They are glued with the authority. If you need help to disease from substance abuse, get to the LDA in Maryland County detachment for guidance. They can give you guidance. They can refer you to where you think you can go. Sure. Reach out to local NGOs. There are other local NGOs. Civil society organization. The Gender Ministry Maryland County chapter, I think they have their office right at the City Hall. Yes, if you get there, they would tell you what to do. Community organization where you find yourself. Help is available. No one has to face this alone. You can't face it alone. Help is available. So that is so important. Help is available. You do not have to face this alone. So with this being said, I think I would like to stop this far